right, and welcome back, everyone, to Recharging the Human Battery Show. I'm your host, Dr. Stefano Sinicropi, joined by my co-host, Mandi, Dickey, who was the only host last week on the show, which was great. We are on AM 950 radio today, excited to be here. And we're going to chat about a very interesting subject today, and that is the fact that through media now and through everything moving at the speed of light and just kind of communication going through the speed of light, we really need to be, as providers, as doctors, as nurse practitioners, as Mandi is, as anyone taking care, and most importantly, as consumers of medicine, we really need to have a discussion on the way things are portrayed in the media and where the information is coming from and how that eventually ends up helping or hurting patients in making decisions on how to seek care, how to try new things, what doctors to go to, what institutions to go to, if to do anything at all. There are just so many issues with this. And so where this all comes from is recently Ellie McPherson, a famous Australian supermodel, came out 7 years after she dealt with a medical condition, which was breast cancer, and was talking about how she used a lot of holistic treatments to help her with her recovery, and actually turned down more than 30 doctors who had recommended chemotherapy. And this story was everywhere, and it exploded in the social media world. And as a physician who I do a lot of social media and I'm on social media, it came across my inbox a lot. And the thing I will say is when I first read the story, because it was typically, just as it was sensationalized, I want to say, because you always want to have these clickbait headlines so people click on your story. And basically, I'll read one for you. L.A. McPherson defied medical advice and refused chemo for breast cancer. And obviously she did well, and that's why the story's out there. When you read that, you think she got a breast cancer diagnosis and she did some kind of holistic thing. She went to the mountains. She did a bunch of high dose vitamin therapies. All these things that are out there. It turns out it wasn't until I actually read the story that she actually had surgery for the breast cancer and then turned down the chemotherapy, which was recommended to just make sure that you clean up anything else that might be there and prevent recurrences. And I'm glad for her she did well, but this brings up a huge there's just so many issues with this, and we see stories like this all the time, and it does affect consumer mentality, and we have to be really careful with some of these stories. And so I posted this on social media, and I got some amazing responses. We're going to talk about some of those things, but we're going to talk with Mandi today about kind of how patients think about these things and how we can best help them as providers to navigate, and how we can help you to understand the ramifications of going different directions, going Western, Eastern medicine, combining. Well, but what's safe? What's not safe? What do you think about all this? I mean, you see these headlines all the time. I mean, they can be completely misleading.
Absolutely. It makes me laugh to watch some of the headlines, because you'll see it and you click on it and the story then has nothing to do with the headline. So there's sometimes not even any kind of correlation there whatsoever. But we have to be careful because young people are watching these things. And I've got a couple teenagers in the house. I know you do too. When we talk to our kids about these things, they read the headlines and they're like, "Oh, this and this thing happened, and that's really cool. I would like to do that." I'm like, just a second, because that might not be true. And it's really a detriment to the people watching, because it's not necessarily the truth, but it gets your attention.
Yeah, and the thing is, I mean, there's some journals that really do a lot of, they go out, because I'll get called on to give a quote or something for an article, but they'll go out and get like real experts, to talk about what's going on. But a lot of times it's just sensationalism, and there's really no hardcore facts in there. So on the other side of the break, we're really going to dive into this subject. It's a very, very interesting subject. We'll see you on the other side. Dr. Stefano Sinicropi here, host of Recharging the Human Battery radio show. If you've been listening to me, you know how passionate I am about health and vitality. As founder of the Hypercharge Clinics, I'm dedicated to restoring your human battery to reboot your vitality, health, and performance. We focus on proactive wellness care, optimizing health and longevity by treating chronic conditions, chronic fatigue at the cellular level, all without medication or surgery. Do you suffer from chronic pain, disease, or just have low energy levels? Do you have more serious conditions? Well, Hypercharge Clinic is for you. We use non-invasive, non-operative modalities to improve your energy, slow aging, boost brain health, and help you to rapidly recover from injury and just to be your very best. Experience the future of wellness today. Call or schedule online for your free introductory session. Hypercharge is hope. Visit hyperchargeclinics.com now. All right, and welcome back, folks. This is Recharging the Human Battery with your host, Dr. Stefano Sinicropi. I'm joined by my wonderful host, Mandi, Dickey, a nurse practitioner. We are on AM 950 radio. And as usual, we're always fired up, and these shows are too short, but we'll try. We'll try today to make some sense and to talk about it's such a complicated topic. It's hard to explain, but it's so important. And it's the soft, it's the, in Western medicine, we're both, very hardcore Western medicine trained. Even though she's a nurse practitioner, they're more open-minded. Except, I'll tell you, in my comments, I've had numerous physicians push back on me saying that, oh no, physicians are very open-minded. No. Okay, let's clear the air. The vast majority of us are not, even myself, I wasn't open-minded to all the things I talk about now. So let's not exaggerate and say that we have a lot of work to do. Just like people on the other side, there's a lot of holistic people that I talk to. They're not open-minded. They think everyone's evil in Western medicine, which is ridiculous because that is a way also to lead people down the wrong path. And people die when there's good treatments. I mean, the last 100 years, what we've been able to accomplish. When I say we, I mean the people that are actually doing the research. I don't mean myself. I had the privilege of training under amazing people, but medicine has come a ridiculously long way. Anyway, that being said, so the two people, we're sitting here right now having a conversation, and Mandi went through her own struggles, and I came to the light, through different means, and we're both massive proponents of holistic, medical practices, meditation, yoga, biohacking, all these other things. So I just want to put that out there because there's two sides of the coin. On the other hand, we're both staunch advocates of proven medical treatments for things like trauma, things like very serious illnesses, serious cancers, things like that, where medicine can really help people to recover, and then they can do all their holistic things. And I think it's really a combination, and they should be combined. I'll tell you, they should. To me, the biggest issue I have is that we're not using holistic care on people that are going aggressive medical treatments, and that really is very unfortunate. Because like in chemotherapy, people that are just going, people that are being treated for depression, anxiety, all these things we talk about all the time they're game changers. Okay, so that being said, let's lay the thing. Let's just lay it down without any reservations here. So now, when we're seeing these sensational stories about people that quote unquote have had a cure from going holistic and just telling the doctors, what, that's cool, don't talk to me about it. I really don't care because I'm going to do these other things and go that direction. There's a lot of ethical and just there's moral issues, there's ethical issues, there's practical. There's just so many issues behind that. Now, I'll share a couple things. I had a great guest on one of my podcasts on the different show that I do. It's called The Stories. So it's about people's how they found the light, so to speak. And she was very sick. and she had a cancer. And she used a little bit of Western medicine, but she went to Mexico and went to these special clinics and did all these other things. But honestly, a lot of the Western medicine stuff absolutely helped because she had to have some procedures. But the holistic stuff really, really helped. So again, I'm a big proponent. I have many, many stories of people that post online that have gone outside the traditional, medical system and had care and done okay. On the flip side, there's also stories of people that have refused Western medical care and, 7 weeks later, they're dead. And there are a lot of aggressive cancers that can kill you in a very short period of time. So we have to weigh the risks and benefits of how we, make recommendations for it. But here's the rub, and I'm going to let Mandi really talk about this some more. The problem with the way that things are portrayed in the media, and you stop me if I'm off base here, is when you're in life, and especially in life and death situations, or places where people can lose a limb or something like that, where they're not getting the right care. I think it's wonderful to share all the stories of healing. And if people have self-healed and it's a miracle, it's great. However, those stories need to really have all the information. So again, the example I gave, I until I really dug into, a couple of better, articles, I didn't even know that she had a lumpectomy for her breast cancer. So I'm over here thinking, wow, it's amazing. She went and she meditated and she was positive and she healed herself from breast cancer, which is fine. And there are stories of that out there. Anyway, that being said, the problem with anything, so if you look at cancer or somebody that has severe diabetes, whatever it is, there are so many subtypes. If you just look at breast cancer, right, there's all these different subtypes of breast cancer. So if you have one versus the other, it's going to be a massive difference in whether you would either, there's some people, I could tell you, there's some types of cancer, the chance of you legitimately becoming completely healing from holistic treatment it's possible, right? And I've seen miracles. I've seen people heal from it. It's insane, but it is certainly not something I would ever recommend if you have tried and true treatments that maybe can give people another 3 years, another 5 years. Like, why, right? But there's other types of cancer, whatever. So when you post something about somebody's breast cancer and they healed, and I don't even know they had a lumpectomy, and then, I said, okay, she had a lumpectomy, at least she did that, and then she had all these other treatments. It took me a while. I had to go to all these articles to figure out, what type of breast cancer did she have? What were her biomarkers? What were all these other things? And then it starts to make a little bit of sense as a physician. Okay, well, maybe it wasn't the riskiest cancer, and that's why she was able to kind of get away with it, so to speak, and do these other things. No question. Listen, yoga, meditation, all the stuff that she talks about, positivity, that goes a huge way in healing ourselves. No question. I'm sure it made a massive difference. And it's hard to, you can't really measure those intangibles, the soft things. However, right, I mean, would you agree, if we don't have the full story, and some young person, like you mentioned the teenager thing, if I'm just a layperson, and all right, I'm a male, right, and I'm in middle age, right, and I see, another guy that got, for example, prostate cancer young, and then treated by going, to the Himalayas and meditating and taking some herbs and doing whatever and got treatment. If I don't know any better, if I don't know anything, and my Facebook feed keeps feeding me the same information, I might be on a plane and go to the Himalayas and meditate for 6 months, but I might not come back. Mm-hmm. If I have some aggressive cancer that I decide that I'm just going to do, whatever I want to do. And again, it's complicated. I'm not saying, I'm not a paternalistic guy. If people want to make that decision, but they seek experts that say, if you do this, you have a 99, and again, I'm a believer, and people might come back and they might be cured. I don't know, but I can't recommend that as a physician, and they're probably going to die. Let's be honest, right? So what do you think about all this? And then we'll go into some interesting comments that people are making on when I posted this very story.
Yeah. So when we think about that things makes me think of our conversation that we had a long time ago about silos. So
Right.
when we get in our silos of traditional Western medicine versus holistic medicine, then you go to either one of those providers and ask questions, and they may or may not tell you the full story about all the things. But then when we're reading all these articles and it's got just a snippet of information, so I've been in neurology forever. The one really good example I can give on this is when marijuana first was being talked about for treating seizures. So I had patients after patients coming into the hospital. We were putting them in the ICU on intubators. They were on ventilators because they couldn't breathe because they decided to stop taking all their seizure medicines because marijuana was going to fix them. So they were using it recreationally to treat their seizures, and it did not end well for them. They're a huge risk if you come in status epilepticus, meaning you continue having seizures because you were taking marijuana. On the flip side, I had another patient who came in who she had side effects to all sorts of medications. She used CBD oil and used it at a direct dose every day, and that treated her seizures until she ran out of the CBD oil. And then she came in and everybody wanted to put her on the same drugs again. So we had a long conversation about if you're going to use this, you have to use it like a medicine. Take it the same way every day, and you can't miss a day. And that was going to keep her off of the medicines that were making her feel like crap. So if they're going to make her feel like crap, she's not going to take them. But it's all the snippets that they were getting from social media. And hey, this might help you, so you should check into it. And rather than asking their providers, they're just going to go ahead and do it.
Absolutely. No, that is it. That's the crux of it. People are going to. It's the way they interpret, and that's why I'm jumping up and down constantly on social media. Sometimes they're just rants or say whatever. It is so important to check your sources, figure out where you're getting your information from, but even more importantly, for the people that are considered experts, one of the recent things that I did, they have to be really careful not to start kind of interjecting things when they don't really understand it. So like, Western trained guys, if you're out there telling people that, holistic things are a complete waste of time, now, if you have very specifics, if you say, hey, a study was done in 2019 and it looked at this particular thing for this particular outcome, and it showed that it was the same as placebo, even then, I caution it because placebo is good, and so we want to promote the placebo effect, but it goes both ways. But again, and sometimes, and I did a whole rant on why I get irritated with my colleagues when they don't understand certain things, or like biohacking and just think, like intermittent fasting. I mean, providing complete misinformation on intermittent fasting, or just taking some sensational article. Oh, intermittent fasting can increase, your chance of heart disease. Excuse me, do you see who sponsored that study? And do you see who funds that person that sponsored that study? We can get into that. That's a whole other time. But there's so much misinformation, and that's why we talked about getting multi-providers, going outside the different thing, getting a good thing, but not making up your mind just because you read one thing or one article, because honestly, it's gray, and there's a blend of the truth, but there are some. There are some things that are generally there are buckets of things that you really need to seek high level medical care. And if you choose not to go that direction, you choose with the understanding of the ramifications. You don't choose because some celebrity posted on Twitter that, CBD oil, healed their, it prevented them from having an amputation from like a diabetic. I mean, people just say anything, and people will believe anything. As you see, we're in a political cycle right now, and the level of nonsense that's out there, and people believe everything. Why? Because they're in their silos, and in this case, they're in these weird media silos. And I can tell you with this Ellie McPherson story, it's very interesting because not only did I read it that morning, but then she was on some morning show, and I saw her talking about it, and everyone's like, "This is amazing," and whatever. And I love the fact that holistic care is being promoted, but it has to be promoted in the sense of, prevention. It's incredible for prevention. It's incredible as an adjuvant care when you have a serious condition. But we're starting to promote it for serious medical conditions. It can become, I mean, it's downright dangerous, to do some of these things. So we have to be careful. And I'm not saying not to do it, but do it with a very complete, like, for example, when they had her on that talk show, my recommendation would have been have her and then have a provider that understands best of both worlds and can just say, hey, I know you're listening, and this is great, Ellie. I'm glad that you did fantastic.
Yeah.
However, make sure that you talk to somebody that really knows kind of what's going on. And we talked, we talked about this. Am I missing anything on this?
No, they needed the full picture,
Yeah,
and
it's a full picture.
It's good on you for
situation.
going to read and finding the other articles to get the details, but not everybody does
Right.
that.
Yeah, how about not everybody does it? How about most people don't
Most
read
people
the
don't do
article? They read the thing and then they're like, "Oh my God, I'm gonna use this herb. Oh, echinacea. Oh, St. John's Wort.
Yeah.
Okay, I'm gonna get off of all my major depressive medications today."
Right.
Because so and so took this herb and they did well. That's stuff. It's not. It's really irresponsible.
Yeah.
Actually, in a way, and so. Even myself, I can tell you that I get excited about things, and I get, now that I'm more in the mainstream and have a big social media following, all this stuff. I get people poke me all the time, and they're experts. I mean, these are physicians, these are MDs, DOs, company leaders, all these people, and they say, "Oh my God, I know you're into health and wellness. You've got to try this new modality or product." And I start reading. So I'll read a couple articles. And honestly, then I'll get ready to make my post. And then I was like, you know what? Before I do this, let me do a really deep dive. I'll post this tomorrow. And I start doing it. I can't tell you how many times I've not posted it because I'm like, well, you forgot to mention the 9 studies where people had this complication from your product or your whatever. And so everything that I try to put out is I try to do responsible, because what I'm doing is journalism, right? Everything we put out. When you're an expert and you're putting stuff out into the ethos, it's journalism. Yeah. It's journalism. Unless you say, you do a caveat. This is 100% just an opinion. I'm just ranting. But even then, as a physician and somebody that people kind of trust and listen to for stuff, I have to be really careful with anything I say. So I'm like, this is really controversial. This is whatever. I'm just laying it out there to start a conversation. I'm not making an overall judgment. I'm not telling you what to do. It's just a conversation. That being said, I think it'd be interesting to see, what some of our, people are responding. So I just want to, read some of these things, and I'll have you, respond to them. You just say what you think about the responses. I think that'll be interesting. Here's one response. Stefano, this is a very nuanced subject that needs context in relation to the decisions made. Type of cancer, stage of lymph node involvement, PET scan results, overall health going into treatment, alternative options. And then this person goes on to provide an example of 2 friends that were in menopause that were treated for breast cancer, and how they were, and then goes on this big rant about talking about how one did amazing and one got violently ill from the treatment itself, and it ended up being like a big detrimental. It did not go well. But again, it goes both ways. But it's very nuanced because they both had a completely different conditions. Don't you think that's? I think it's a great
100%.
response. That's right on the button.
100%.
Right. Okay. So Mandi approves. Whoever you are, I'm not gonna call out names because I haven't asked you, if I can, do this. So this one. I'm not as clear on this one. This guy's actually a orthopedic surgeon. He says, if quote unquote Western medicine is truly based on physicians determining the best available treatment for the patient, then all treatments with evidence should be on the table. He goes on to say, and I kind of mentioned this before because it's stuck in my mind, I truly believe that most physicians are very open-minded to any form of treatment that is presented with proof of efficacy and safety, even though sometimes the proof gets obscured, biased, and everything can be, abused. He goes on and he's like, that's where most holistic treatments fall short. We need alternative treatments to demonstrate more than just anecdotes. What say you?
See, my problem with that is that there is a lot of research on complementary medicine, but it's not in the mainstream like New England Journal of Medicine. So there is research to back it up. And I would disagree very much that most providers are open-minded because even
I'm with you on that. I already said it.
yeah, it's just not there. Because I've had patients bring things to me, and I'll say, "Yeah, let me take a look at this. I've not seen this before, and get back to you." But most physicians, I'm sorry, are not going to say that.
Yeah, listen, I love you guys. You're my folks, right? I love my physician colleagues, right? I'm with you. I'm fighting for you on burnout. I'm fighting for you on autonomy. I'm just out there fighting for you. In fact, I'm on a podcast tomorrow where I'm going to talk about all the things we need to do to make physicians' lives better. But very open-minded. I mean that's hyper.
Some, yes.
Some are very open-minded,
absolutely.
like everything.
Yeah.
But I mean, as a general group, no. I talk to physicians all the time. Very open-minded. Those are not adjectives that I would be. I wouldn't.
They don't go in the same sentence.
Yeah, that's not even a thing. I'm sorry. Generally, I have friends and people that I just know and people I've had on my podcast and people that I talk to all the time. Massively open-minded. In fact, they're way more open-minded. They're floating like these crazy theories to me. I'm like, I don't know. I don't know about all that. And the other thing that's real interesting is, what he's trying to get at with the alternative medicine thing. I have two pet peeves about it, and I've talked about it before. One, you're absolutely on the money. They are in obscure journals, and you have to look for them, okay? The problem with alternative treatments, people don't know this. They have to understand things. Because of the pharma industry and big food and all these other things, again, my role, I'm not going to, if you want to really know stuff, go listen to RFK or those types of people. That you'll find out stuff that you probably don't even want to know because it's very upsetting. So we're not even going to go there because that's not my role. I'm really trying to educate people on how they can be better. But people have to understand because now, with our wellness projects, I'm being now solicited to do research projects with Hypercharge for people that are looking to get their alternative modality in because they cannot afford. I will tell you, I talk to CEOs of these smaller companies who have great biohacking things, or they have some product or something like that, and actually great safety profiles, very safe. It's not the worst case scenario. It's like giving somebody I shouldn't say a sugar pill. No one should take a sugar pill. A salt pill. How about that? That's not as bad. But anyway, they are so frustrated. So just to give you an example, just to do a little tiny study, I had a recent CEO reached out to me. He said, "Hey, would you mind trialing this product? And they'll pay for the whole thing. They'll pay for the patients. No one has to pay a dime for it." And they said they went to a famous Cancer Institute and wanted to do this study, and they were quoted $250,000 to do the study. And he's like, "I'm going to be I can't." He's like, "That's valued more than my company. Mm-hmm. I can't do that." So the problem is that the reason it's a lot of retrospective studies and anecdotal studies is because their money is not there. I will share another story. There's a very famous doctor with a very famous institution. Again, I try not to use names but this is true. I don't make stuff up. He's very, very, very upset because amazing research and has asked the NIH for all this funding with rock solid proposals, with things that have no risk. They've already proven there's no risk or negligible risk. We never say no risk in our business. And has been every application is denied, except some of his colleagues that are doing very invasive things or things that have to do with pharma. Instant, mm-hmm. They could write it on a napkin and they get approval because our entire system is just so sucked in to everything being medications and procedures that a lot of these holistic treatments it takes a lot of money to do prospective randomized trials, and that's why there's. And I agree, we have to do way more. So I'm counting on the institutions. I'm counting on ourselves with our wellness, clinics to get some of this other stuff out there. But it's bad. One last thing that I'll say is there are things that are even, and we have to prove them on the other hand, and this is where whatever. So I mean, I always try to use data, but there's certain things. For example, I'm going to give one example of a biohack that it makes me laugh. Number one, there's a lot of data on it, but I can tell you, if there was no data on it, it wouldn't matter to me because it doesn't matter. Laser therapy for pain.
Yeah.
Because I was a big skeptic. Yeah, I read some of the articles, whatever, and even some of them were really positive. I'm like, I don't know if I believe this. I don't know what this is about. But then we treated all these athletes with laser therapy for pain. The first one, you're like, oh, that's cool. They got a really good result. Then you get 2 or 3 people, you're like, wow, maybe it's a coincidence. Maybe it's just people, it's placebo effect because they really think. When you're on your, 12th person and 11 out of 12, whatever, I'm just throwing out numbers, but almost everybody is having dramatic relief of their pain. And then I talk to other surgeons, like I talk to a lot of surgeons across the country now that are very into laser therapy, and they're saying they're using it for postoperative pain management on their patients, and there's like, it's revolutionary. Yeah. It's a game changer. They use things like it's almost malpractice not to do it for pain management if the patients will, consent to doing laser therapy for their pain. Those things, folks, okay, if it's just some things have such strong anecdotal evidence that it's beyond it's beyond a reasonable doubt. So just give you an example. If I presented the anecdotes from treating, and especially laser, because laser is it is so specific, and the results it's instant as far as your pain relief. And then obviously you need to do it over time. But if I presented that in a court of law to a jury, you're meeting the burden of proof way beyond the thing. Like when we present, like in our American system, right? When you're presenting things in front of a jury, you're not like, okay, this person committed a crime, but let me present to you this randomized controlled clinical study that we did on, 19 other they're a serial killer. There's 9 people that's shoved away. You don't need all that stuff for certain things. Yes, we need to do a retrospect. Now, in the case of laser therapy, there are studies. Yeah. But I want to say, as a physician, I wouldn't need those studies to be super comfortable being able to, because the risks are so low. Yeah. Now, it's very different. If I'm giving somebody a pill that could make them, for example, GLP-1s that can make them have, like their stomachs basically don't work anymore, right? They have gastroparesis that never gets better. Mm-hmm. I'm going to be exceedingly careful to recommend that. If I'm recommending light therapy to somebody, I don't need 20,000 studies that show that, because otherwise it's like they're just going out in the sun with no risk of cancer, because there's no UV, there's no UV in there. So I don't. So anyway, thank you for that. Let's get to the next one. Sorry, I digress. So here's another one. Deeply support this study. The current conventional medical model will be forced to evolve due to patients like Ellie. Great to hear this story where she decided towards a holistic medicine model. Great, transformation. Looking forward, to hearing more. And I promised everyone a video. It's coming. I have to. Sometimes it takes me longer than what I say because it's complicated. The one thing I would pick out there is I agree that the current medical model is going to have to change, because if we as Western providers don't understand the things that people are seeking for, and they come in, you come to me and say, hey, I had this concussion and I'm going to try X, Y, and Z, and I'm like, you're kind of. Are you like you have a couple screws loose? Something wrong with you? Well, if you're not going to do my treatments, then that's good. Good luck. Yeah. Let's have fun with that. Yeah. That is a problem.
Yeah, it needs to transform 100%. For 6 months, I did the traditional Western medicine inside the box thinking, and it didn't get me any better. It wasn't until I tried the photobiomodulation, everything else that actually started working. Doesn't mean I stopped doing my Western medicine stuff. It worked alongside of it. So absolutely needs to transform. We need to be more open-minded all over the board.
But we need providers that understand, now, and I wish I could go back to, 19 years ago and tell my 19-year-ago self about all these holistic things, because I understand, because I'm sure that I myself kind of blew people off and said, yeah, that's nice. Okay. I've always been nice to people. I never been a discourager of anything, but in my mind, it'd be like, I'm like, okay, that's fine. But now having really a good understanding of this stuff, people are very happy. They love it because they'll say, oh, I'm trying to, I'm like, oh, that's great. Let me learn more about it. And I know you do this all the time. And they're so happy because, and then they're more willing to be open when I say, well, that's all great, but you need to have this surgery because that's not going to prevent you from paralysis. Yeah. And they're like, okay, I get it, because my doctor knows that I love acupuncture and I also want to do that. But my crushed spinal cord is probably not going to respond to acupuncture. Right. That's just one example. Same thing with diabetes. Same thing with any of these other things. Let's get on to another comment. This is good. It's important to provide patients with all available information and guide them towards the best treatment options. Ultimately, we should support patients in their own health journeys, regardless of the chosen approach. And so,
100%.
Agree, right? If we provide them all the information and they understand, they're crystal clear, but they also know that you understand the stuff that they're going to try. And you're just like, listen, if that's going to do it, I'm not there. That's their life. It's their life ultimately. Like, they have to make that decision. People are allowed to choose what they do. It's my role is just to to give them the best options. I wanted to pull a more pro holistic one, because most of those were very balanced. So this is Neil Gannon. He's great. He's all over social, so I can use him. He's been on my podcast. So he commented here, I love that she had the courage to do this, despite what she had been told about from most medical professionals. I agree what you wrote with the above. And he's like, you might guess what my position is. I feel we need to completely redefine cancer. Ask anyone who's reversed cancer without medical intervention for their definition, and they'll tell you it's something far different from the fearful definition that has been programmed into us since we were old enough to understand. He lost 3 friends to cancer. He talks about this, very, very openly, and he feels like they didn't necessarily need to die because their whole body systems weren't working well. And he has this 4-pillar mentality where people, work best. What I would say, and I'll let you say, is I really love Neil. He's great, and I encourage everybody to follow him. His stuff is really, really amazing. What I would say is, again, I would always go back to, I'm fine with holistic treatments, and I think they need to, and especially in the preventative stuff. Because, listen, we both talk about this all the time. Most cancers, yes, there's genetic predisposition, but your lifestyle choices are massive. If you're doing these holistic treatments, if you're positive, if you're meditating, if you're eating well, if you're doing all these things, your cancer risk goes down. That is in the Western medical literature, but no one seems to care, apparently, because the way we live our lifestyles. But what I would caution, and I believe all this stuff, the problem. And I think, are there people that have completely reversed their cancers with nothing from Western medicine? Absolutely. The problem is that's where we have to look at them, because those stories are always sensationalized. But what about all the people that died when they could have been saved? So there's always stuff. So I'm really careful to see all that. But certainly, if I have a person that is hardcore and they're like, there's 0 chance I'm taking any of your drugs, pills, or having surgery, then I'm going to support them. And then I'm going to do the research and say, listen, I know you're holistic, but have you thought about this holistic clinic in Mexico that does even more advanced stuff? And I hope it goes with your ethical, considerations. Have you ever heard of that? And they might say, oh, thanks, doctor. I actually haven't heard of that. I'm willing to try that, but I'm not going to go see your buddy who is like a renowned cancer specialist. And I'm sorry, that's not what I'm doing. I respect that. But for the general population who just doesn't know, they really need to seek a lot of opinions, because they, on the one hand, yes, the holistic stuff can make a radical difference in them, but if they have specific things, they could also risk killing themselves because, they didn't do it.
Yeah, and I think it gets back to what we said earlier, too. It depends on the kind of cancer, the degree where you're at with it. and still keep close follow-up, because if your holistic treatments aren't working, maybe you do need to consider something else or just even hear about it.
Very interesting. There was one that brought up Steve Jobs and his holistic treatments. That didn't work out so well. The Steve Jobs, pancreatic cancer is a difficult one. Again, I don't know. I mean, we can talk about it on another episode. I'd have to go back because I've never really studied Steve Jobs cancer, so I don't know exactly what he had. I mean, there's one type of pancreatic cancer that is curable if it's in one part of the pancreas because it's removable. Most of the other ones, the prognosis is not so good. But as we wrap up here, most of the comments, people were on that. They're like, not all cancers are alike, and we need complete information. So you know what? Kudos to the people that are responding here, because I thought I was going to get a lot of really hardcore holistic people, because a lot of them do follow me. Yeah. One final one, this person's upset. Thoughts like emphasize. My mom died from chemo poisoning. Her organs were not strong enough. Now, chemo, again, holistic stuff can help with the chemo. So I think a combination of the two. It's complicated, and we're run out of time, so we can't do that. We'll talk about that briefly on the other side of the break. But hopefully this stimulated some thought. We'd love to hear your thoughts in the comments underneath the podcast section on AM 950 radio website. We'll finish this up on the other side of the break. Chronic disease, poor sleep, post-surgical recovery, aging, brain health, low energy, post-COVID syndrome, addiction, recovery from injury, cognitive decline. As a long-time practicing surgeon, I wanted to design a clinic that could address all of these issues without medications or surgery. This is Dr. Stefano Sinicropi here, host of Recharging the Human Battery Show and founder of Hypercharge Clinics. And I know it seems too good to be true, but believe me, it's not. Hypercharge Clinic specializes in optimizing health and longevity, combating the symptoms of chronic disease by treating the cause at the source, the cellular level of the body, by targeting the core of our cells, the mitochondria, with non-invasive therapies like Class 4 laser, red light, and many others. We are introducing a new era of medicine that promotes faster healing, pain relief, wellness, and human performance like never before. Experiencing is believing, so call us and schedule your online free introductory session today. Visit hyperchargeclinics.com now. Hypercharge is hope. All right, our time is almost up, everyone. We are on Recharging the Human Battery on AM 950 radio. This has been, I'm having fun here. Again, how many times do we say that we need 2 hours for the show? 1 hour?
Almost every time.
I have a million things I want to talk about, and we're just not going to get there. And obviously, every show is not going to be about the same, topic. Very interesting. I just want to finish one more, comment, because it's we can. So anyway, great share. It's my understanding that Ellie is not giving anyone medical advice. She simply makes her own decisions. What I find admirable is she doesn't take a doctor's word as gospel, choosing to explore alternatives. Too many people are afraid to question anything the doctor says, and I truly believe we should stay informed, do our own homework, and take the wheel on our healing journey. You know what? Kudos to you. I'm all for that. What's my mantra, right? That I got from my good friend Margaret? Be the CEO of your own health. I agree. You absolutely need to make your own, decisions. I mean, we could do a whole. I can do literally my clinic the other day. I could do an entire show here about the crazy stuff that other providers told my patients. It's just bizarre. And so that's why it's important. And I'm sure some of the stuff I say is not probably right for that patient. And so they should keep getting other opinions. So I'm 100%. The one thing, but what I want to say is things have absolutely changed. So let's not exaggerate in that. Let's not say that most patients take what the doctors say as gospel. To me, it's becoming more of a split. Mm-hmm. I mean, half of my patients, I could tell them, to stand on one foot and jump around, and they're, okay, doctor, where do you want me to do it, here, outside in the hall? And then the other half just stare at me no matter what I say, and they're just skeptical for the first 15 minutes but once they get to know me and see how open I am, then I can get them to warm up and whatever. But they come in, they're totally skeptical, thinking I'm going to try to force them to do something. So I think it's a split. What do you think on the gospel situation?
I think you're spot on that too. I don't think it's so much that everybody just walks in and they're going to do whatever you want them to do. It's more of a team, and we've been trying to communicate that for a long time, and people are catching on to that. They want to be part of that decision and not just have somebody tell them what to do.
Yeah, and like I mentioned before, the word paternalistic really, we need to, it's important. We as a medical community can be forceful. We can say, listen, I'm just letting you know, I've been doing this for 20 years, and if you don't have surgery, your chances are very, very poor. But it's your decision. I always tell them it's your decision. And I do tell them there are people that have decided not to have surgery. Some have snuck through, and some it's very bad. Mm-hmm. So and then make your own decision. And I do encourage people, especially on the complex things, to go out there. On the other hand, it is my own personal pet peeve where providers really try to force people to do exactly as they say with dogma, because there are things that are very straightforward, but most things are gray. And so it's the way we talk to people, it's the way we understand people, and when we talk in a paternalistic fashion, it's very detrimental to the patients, and they feel upset and they feel like we think that they're idiots. And I don't. I'm the opposite. Because honestly, we all know a fraction of what's going on. It's just that the people that are like myself, like you, we're considered experts only because we've spent decades, learning this stuff too. But we're learning stuff where we don't know everything, and those experts that we're learning from, they don't know everything, and they change their minds too over the years. So, in closing, what say you?
Textbooks were written, and we've learned more since then, so everything needs to transform. So I think this whole conversation is just kind of repeating that. We need to transform, but we need to do it in a wise manner.
No, absolutely. And on that note, our time has come to an end. I'm sad. This is one of the most time. I'm more sad than I've been before, because this is a conversation we can go on forever. Hope you enjoyed this episode. We'll see you next week on another episode of Recharging the Human Battery on AM 950 Radio. I'm Dr. Sinicropi, joined with Mandi, Dickey, and we will see you on the next episode.